Well, welcome everyone. My name is Stacy Ward. I am the CEO and currently still acting Director of the Family Support Program here at PWSA USA. Welcome to our August Family Support webinar with Dr. Destiny Pacha, with over 20 years of 20 years in education has transformed her career from a general education teacher to a specialist in inclusive education. Her passion led her to develop a co-teaching model for special education and to take on roles such as a behavior specialist, an inclusion facilitator, and an exceptional student education specialist. She's a proud UCF Knight and has earned multiple endorsements and degrees from the University of Central Florida, including a Doctor of Education in Special Education, where her research focused on enhancing inclusive practices for students with disabilities. Her dedication to students with diverse needs extends beyond the classroom through personalized coaching and consultation as the founder and CEO of Empowered Education Solutions. Dr. Pacha recently authored It Starts With Hello, Katie's Story About Prader-Willi Syndrome. It's a unique children's book that fosters empathy and understanding by celebrating differences, and is the first children's book written about Prader-Willi syndrome. So welcome, Dr. Pacha. I'm going to let you take it from here.
Thank you. I'm so excited to be here again. I think tonight is going to be a super informative session because this has become a topic that I am struggling to see not happening in schools. I often am, invited into meetings or consulting with families, and one of my first questions is there an individualized healthcare plan as part of the IEP? And often the answer is no. And I'm always shocked. So this has kind of become one of those missions of mine over the past year or so, is to inform parents and schools sometimes on the importance of an individualized healthcare plan. So I am going to attempt to share my screen. All right. So again, tonight we're going to be talking about how to secure safety in schools through an individualized healthcare plan. So I do like to give a little bit of information in the fact that I am not an attorney. I do not practice law, and I am not a medical professional, so I do not provide medical care. But I am an education specialist and consultant. I now solely work with families of children with Prader-Willi syndrome and other genetic disorders. So that is how I have kind of turned this idea of needing to have this healthcare plan, especially for disorders that are as complex as Prader-Willi syndrome. So what is an individual healthcare plan? So the National Association of School Nurses has defined it as a written document that outlines the provision of student healthcare services intended to achieve specific student outcomes. What needs to be looked at is it something that is going to be impacting their academic performance or attendance? And when it comes to Prader-Willi syndrome, yes. So how do you become eligible for an IHP? Who actually needs it? So the way that it works is that students with health needs affecting their daily function or safety. And this criteria is stating that the plan is needed to train staff for additional safety measures, for maybe specific interventions and medication management. So the medication management is more when students have to take some medications at school, which may or may not apply to your child. So you may ask, how do I know if my child needs one? So ask yourself, does my child have a health condition that requires ongoing nursing services at school? I would expect most of you to say yes. Does your child become immune suppressed during maybe times of the year or during certain outbreaks? I would imagine you would say yes. And does your child have a long-term illness but is well enough to go to school? With the diagnosis of Prader-Willi syndrome, you can say yes to all three of those. So a healthcare plan, or an IHP, we often are talking about IEPs and maybe even early on some 504 plans. So where do they differentiate? So an IEP outlines the special education and related services, and that's for students who are found eligible under the Individuals with Education Act, Individuals with Disabilities in Education Act, and guarantees a free and appropriate public education in the student's least restrictive environment. A lot of like key terms in there. Ultimately, most children with Prader-Willi syndrome have an IEP. A child could also have a 504 plan under the Rehabilitation Act. A 504 plan is different than an IEP because it only outlines accommodations and related services, and a child does not have to be eligible under IDEA to have a 504 plan. What they have to have is a disability, physical or mental, that substantially limits a life activity. So you cannot have both of those. Your child would be eligible for one or the other. However, a healthcare plan can be part of either one of those. So the healthcare plan ultimately is the blueprint detailing the school nursing and health needs for the staff that is supporting the student at school. So your healthcare plan can be part of your IEP or part of your 504 plan, depending on which plan your child is eligible for. So I do want to kind of differentiate the services that kind of the terms get thrown around sometimes. So school nurse services are exactly that. It's a registered nurse who provides services to students in school. However, school health services are not required to be done by a nurse. They can be done by a person that has been trained by the nurse or another qualified person. Even a trained paraprofessional can provide health services. And we'll get into that later about, do you have to have the nurse? And then medical services. This is really important. And I try to emphasize, when we're talking about schools, we want to talk about the health side of it. Medical is very different. Medical services are done by a licensed physician. So often when we throw around health and medical, the difference in school can be pretty impactful, because we know that you can be eligible for an IEP under certain disabilities that may not have a medical diagnosis, such as, let's say, a learning disability. You may not have a medical diagnosis or done by a school or by a psychiatrist or psychologist of having a learning disability, but you can have an IEP for one, and vice versa. There are students who, have a medical diagnosis of autism, but don't have an IEP for autism. So that's when the health part of it becomes important. That is within schools. So what can go on an IHP? So this is not an all-inclusive list, but these are some of the important ones. So obviously, any triggers, which we obviously recognize that there are specific triggers that could be associated with, behaviors that may increase or safety concerns. So for us, obviously, that would be looking more at the foods, having food in the classroom or having food that's, out and about, that they have easy access to. So that is a trigger that could be outlined on the IHP. Self-monitoring procedures. This is for students that are typically a little bit older, and not necessarily for children with PWS, but if it is maybe a child with diabetes that has a way to monitor themselves, there would be procedures outlined for what the child can do and what the child can't do. Healthcare needs at school, that's very broad. Obviously, anytime that a child has some concerns that need to be monitored, observed, or watched for. Precautions and interventions. So things that you can do if a child starts, let's say, overheating. What are some interventions that can be put in place? What are precautions? So you're proactive, limiting their exposure when the temperature outside is over a certain degree, or vice versa with the cold temperatures. Special considerations are things that would be such as field trips or community-based instruction. So when a child might be doing something off school campus, this could also even be extracurricular activities. Anything that is school, overseen, this would include during those times. So that would be after school activities, clubs, sports. Obviously, our biggest one that often is the first focus would be your nutritional and dietary needs. So monitoring whether you send in all your child's foods or if the school is responsible for following a medical diet, that is going to obviously need to be included in the IHP. Treatments to perform. So if a child has some sort of medical device that might need to be cleaned or monitored, that would be outlined in there. The medication management, we kind of talked about that if your child requires medicine at school, or when and what can be provided. Let's say if they're not feeling well or they start having a temperature, obviously with PWS, that needs to be strictly monitored for any side effects. So we want to make sure that they know what can and can't and when they should not be administering medications. Accommodations, which you're probably pretty used to with the idea of maybe having an IEP or a 504 plan, or even just an education plan if you might be at a private school or a charter school that provides those accommodations. There are going to be some accommodations needed for a child with PWS on their healthcare plan. And then one of the biggest ones that I think is often overlooked are the responsibilities. You develop this plan, you have all of this information on it, but nobody knows who is supposed to do what. So it really needs to be detailed of when do you contact the nurse? When do you contact parents? When is there a crisis plan that you might have to call 911? Who is responsible for that? Because you don't want everyone just kind of pointing fingers and expecting somebody else to do it. So what are the goals? The goals of an IHP, one, it communicates your concerns regarding your child's health. So this is an opportunity for you to explain why these are needed and the idea of the repercussions if there aren't precautions put into place. Obviously, the actual plan implements the plan, the unique health needs of your child. It's outlined, it should be detailed. And then also any of the procedures, the medication, the monitoring, and again, the responsibilities of the team. So you now know about it. What do we do from here? So when it comes to implementing one, really your first bet is to contact the school nurse. And because as we'll talk about in a little bit, you're wanting it to be part of your IEP or 504 plan, you'll also want to contact your special ed contact at the school. So often that's called the LEA, or it might be your case manager. Every state kind of labels it a little bit differently, but whoever is your main contact for your child's IEP or 504 plan. Ultimately, you're just going to alert them of your concerns. Preferably, this would be before school starts, if possible. Request a meeting with the nurse to discuss the health needs, have the option, the availability of asking questions, and helping the team understand why this is so important for your child to have IHP that outlines all aspects of PWS. Then it's best to kind of start gathering, if you haven't already, all your documents that the nurse might want to review. So any notes from your physician, the letter or note that indicates that your child has the diagnosis of PWS. Communicating with your doctor, giving consent to have information shared. The nurse may want to contact the doctor to kind of get more specifics on your child of when and what to do for certain procedures. Then I say, go ahead and review the common PWS health needs. I know this sounds like something that you'd be like, well, I already know this. There are so many aspects of PWS that you want to make sure that the school is aware of anything that can affect your child, because typically we go straight for the food concerns. We go for food security, making sure that there's not food in the classroom, but we also have to remember the hypotonia. Then you have also the dehydration parts and the inability to regulate their temperature. And so sometimes there is a pretty long list, and you want to make sure that this plan is specific to your child as well. And not all of them may be appropriate, whereas certain ones might be more important for your child. Obviously, you'll want to refer to any medical and health information that's out there from a reliable source. PWSA USA has some great information out there, some great printable fill-in documents that kind of go over and you can adjust for your child. And then ultimately, there has to be a determination that your child needs this plan. The nurse is the one that would make that determination regarding the IHP, and then would be the one to develop it based on their assessment. So what does an IHP look like when you actually are going to get a document? Unlike IEPs and 504s, there is not like a standard set anywhere. It is not a federal legislation like IDEA or the Rehabilitation Act, and IHPs can vary. I have seen so many IHPs, some great, some not so great. And they can, even within a state, they can differ from district to district. So I'm not always so concerned about the format of it, as long as the information that I want on there and that your child needs is included in some way. And I will show you some specific examples in a little bit. With that being said, there is a scope and standards of practice that does outline what should be on an IHP, and the process for developing one. I have not seen a lot of schools go through the full process and have all parts implemented on the IHP. So this would be something that you might want to make sure that the nurse is aware, that you're aware of what needs to be included on there. These are some books. So the purple one is the Scope and Standards, which does kind of outline the process we're going to talk about. And then the two on the right are books that I personally have purchased. And the volume 2 of the School Nurses Source Book actually has a section on PWS. So I have utilized that in making templates or helping school nurses. The first volume is the very common diagnoses that school nurses see. The volume 2 is the one that goes into more specific, specialized, rare disorders. And like I said, it does have a chapter on PWS, which I was super excited about. And then there's also supporting and accommodating students with special healthcare needs that also goes into kind of outlining the steps and what needs to be included. So what does the scope and standards define this nursing process of in developing this plan for your child? So the first part that they should do is an assessment time. So this is where they collect data. They may do observations of your child. They're likely going to review the medical documents that you're going to provide or that you've given consent for them to communicate with your child's physician or endocrinologist or anybody that is currently, providing guidance for you when it comes to your child's medical needs. And then, as always, the input should be coming from you as well. So all of that is the assessment. It does not mean that the nurse is actually going to complete some sort of medical procedure. They're not going to, be doing anything physically with your child. It's more of the data collection to be part of this assessment. And then they're supposed to make a diagnosis. So this is kind of a little, I put it in quotes because it's called a nursing diagnosis. Your school nurse is not diagnosing your child with anything. They are to be treating and supporting your child's health and medical needs. But in this nursing process, this nursing diagnosis is more of a verification that your child has these diagnoses that you have now shared with the nurse. So obviously a parent that goes in and says, my child has Prader-Willi syndrome and needs all of this stuff, through the assessment process, the nurse is going to look at all the documents, the medical forms, any health-related documents that you provide them, and then diagnosis affirms that your child has Prader-Willi syndrome and therefore has these required needs. So then comes the outcomes. These are kind of the desired goal results of the nursing interventions and expected student outcomes. Obviously, having your child safe and secure at school is the biggest outcome that you want, but it could also be as detailed because you do want it to be measured that, a child will maintain, a temperature of whatever is norm for your child, which also nurses need to know what that is, right? Because they may think your child is fine, and for them, they're running a fever, which we also know is highly uncommon when it comes to a child fighting some sort of illness. So all of that, the nurse needs to have and be able to monitor. Then they develop and implement the plan. So the IHP is developed, it's put into practice, roles and responsibilities are disseminated, people know what they're supposed to do, and then any care that is needed should be documented. School nurses keep a very tight log of, when students come in, any services or supports that they have to provide. But it's especially important when there's an IHP because you need to know what has been utilized, maybe what hasn't, what has become a need, or what was never really a need, but that you're being able to monitor what actually is put into place. And then you're supposed to evaluate. The nurse is supposed to be continuously checking, is this plan effective? Is the child having to go home because they're sick a lot? Is the child having to go home more often during this time of day due to overheating? Well, then we need to be looking at the plan and deciding, okay, we might need to change how long they're outside or maybe the temperature. And obviously you'd be communicating with your physicians to kind of get that updated information and adjusting as needed. This really should be a continuously fluid document, just like your child's IEP or 504 plan. As needs change, this plan should change. And this also can be as your child moves through the PWS nutritional phases. What really can't be happening once your child is hyperphagic may not be what is needed when your child is really young right away, but may end up leading into that. And that's also important for the school staff to know what could be coming or what we need to be looking for, because as soon as that happens, you need to know to then let your physicians know. So I decided for the rest of this to kind of answer questions I often get. And these questions are questions that you might have, and these also might be questions that school nurses, if they're on here, or schools might have in general about IHPs. So one of the common ones, because you're sitting in an IEP meeting and you're saying, my child needs an IHP, can the IEP team write it? No. The IHP can only be written by a school nurse. That is their responsibility to develop the plan, because they have to go through their nursing assessment procedures to then develop the plan. Often I get asked, can my doctor just write it? My doctor knows my child the best. My doctor, we already have kind of these plans in place. No, this is where we go back to that medical versus health. Doctors don't actually have authority in the schools to write these plans. However, they are able to provide the nurse with any of the medical information needed, or maybe any specifics for your child of certain temperatures, certain time outside, obviously the food amounts and portions or calories, however your family has chosen to monitor that, all needs to be, communicated between all parties. This is a tough one, and I get asked a lot. What if the school doesn't even have a nurse? How am I going to get an IHP? So school nurses are like other related service providers, and other related service providers are your occupational therapist, your physical therapist, your speech and language pathologist. Those are related service providers or itinerant service providers, and they may cover multiple schools. However, all public schools have a nurse. They just may not be physically on the campus. So the nurse that's overseeing your child's school must take then the necessary steps to train staff and to supervise things that they have delegated to that staff. So that's where we talked earlier about whether it's a nursing service or a health-related service. A school nurse would then come in and train the staff to follow the plan. And then they also need to be following up and supervising and making sure that it's happening and taking place appropriately. So you're now signing over your child's medical information, your child's medical records. The school nurse has the opportunity to maybe speak to the doctor if you've given that consent. So is that confidential within the school? Yes, absolutely. Any information that the nurse receives is considered confidential. It's not under HIPAA, which is what we're used to in our medical offices, in our doctor's offices, but it is under FERPA, which is your Educational Records Act. So it is required to be considered confidential, monitored, and obviously protected from others viewing that. However, again, this is where some schools have asked parents to give permission to put stuff in maybe a substitute folder. And I do believe that that is extremely important, because in my line, if I see a child that has been able to access food or, was outside too long, it was often when there's a substitute and the substitute doesn't know. So I, help schools in developing what can go in that folder. And often it can be documents from the Prader-Willi Syndrome Association, obviously, or FPWR. But if you want stuff specific to your child, then sometimes schools will ask you to consent to including maybe your child's All About Me that has a medical alert on it, or information specifically about your child's medical needs. So if you get asked that, don't be surprised, just so that they know, because a substitute is not always an employee of the school. A lot of districts are now contracting out for substitutes. So again, making sure that they don't want to get in trouble for disclosing something that we, in this situation, want to have disclosed so that your child is able to be safe in class. So school has already started in a lot of the country, not all. Is it too late? No. IHPs can be written at any point in time. It's just like an IEP or a 504 plan, as long as the school and the nurse go through the process. And the document is truly meant to be fluid and dynamic in that, again, it changes and goes with your child's needs. So your child has an IEP or a 504. Now your child's going to have an IHP. Are there other plans that are out there in the school system? Yes. And special education loves acronyms and all kinds of letters. I call it like the alphabet soup of special ed. So there is another plan that can be in place called an emergency care plan or an ECP. This is considered an intervention that is part of the IHP though. So the IHP is there. And then if your child requires something specific for an emergency situation, this would obviously be if your child was found to have gorged on some food or obtained something that they should not have eaten. What are the steps for the school to take? And the ECPs, they go beyond action plans. So there's a lot of action plans that are out there that school districts have access to and will implement, again, kind of under the IHP. So for example, there are a diabetic action plan, a seizure action plan. A lot of those action plans, though, are more general of things that, a school staff or teacher would need to know about steps for a child with diabetes. An ECP is more specific to your child of, if this happens, this is what we do in the case of an emergency. Other plans to think about and can also be included as part of an IEP are the evacuation and lockdown plans. So especially for students who may not be as mobile as other students or require some sort of mobility device or even, a communication device. If there's an evacuation, they need to know what to do to get your child safely to where they need to go. And also, if everything is going, let's say, for an evacuation outside, it's August here in Florida. It was almost 80 degrees at 6:30 this morning here. If there is a bomb evacuation, then they could be outside for an extended period of time. So there needs to be a plan of contacting a parent, steps to take, when to do that. Is there a certain amount of time? Are certain plans where you're told, that this is happening? They can recommend at that point. Obviously, you don't want your child to be out in 90+ degree weather for 5 hours. So those kind of things are something to think about, even especially if your child's on a second floor and going downstairs. I mean, we know that that can be difficult in general, especially if a bunch of children, young children are, in the midst of alarms going off and they're scared and the anxiety is increasing. How do we get your child out of the building safely? And the steps that are needed to do that. And again, who's responsible? So if this happens, Mr. John's going to come in and assist going down the stairs. But if it's this, then Miss Susie is going to call mom and dad or, your guardian or family member to alert them and give them the option to come pick them up. So now you've gone to school, you've requested an IHP, you've developed an IHP with your school nurse. What do we do with that on the IEP? Do they stay separate? Do they come together? Where does it go ultimately? So an IHP can be attached to the IEP. It can also be referenced in the IEP or both. My professional recommendation is both. Typically, IHPs are kept in the nurse's office. That's great, unless you need a teacher to have access to it. Typically, nurses will do folders, like confidential folders, and give every teacher every year. But we also recognize that there's a lot of service providers, like we already talked about, that might come into the school and work with your child 30 minutes a week, and they go into the cumulative file, pull out the IEP, and they're looking at it. Having that healthcare plan right there gives them direct reference to it. Also, making sure that it is included on the IEP. Schools sometimes will question this because they're like, well, they already have an IHP. So we don't need to discuss that any further. They have two plans. No. The IHP should be included on the IEP. And there's a couple places as a related service, because health needs, nursing services are a related service, like we discussed. It can also be listed under a supplementary aid and service, because an IHP is an additional plan or an associated plan. So it is a supplementary aid to the IEP. And I'm going to show you a couple examples in a minute. Some districts are starting to have a section on the front of the IEP that says associated plan. I love this. That is where your evacuation plan can just be listed. So anybody getting that IEP knows there are additional plans that I need to go find if it's not attached. So under that could be your behavior intervention plan, your individual healthcare plan, your evacuation plan. So all of that can be, and it's listed. That is absolutely something I would hope that eventually every state and district would do. So here are some of those examples. So on the top, that is that associated plans. This is a local district actually has it on there. At the top, like I said, on the front of the IEP. These are actually cut out of real student IEPs. So some things have been redacted. That this child has a positive behavior intervention plan and an individualized healthcare plan. So as soon as you look at the front page of that IEP, you know that there are additional documents you need to reference. Then you have supplementary aids and services. You can see there where the behavior plan is included, continuous supervision is included, daily notes home is included, and then at the very bottom, the individual healthcare plan. And you'll notice they also have a Prader-Willi action plan. I've only found one district that has this. So you'll see where I actually have cut out, from the top, they have a Prader-Willi action plan. Then you may also see the IHP called other names, but it all technically is an IHP. So an individual healthcare plan or a nursing services plan, because we talked about those can be on the IEP as related services. Then this one is done where it was actually as an accommodation. So it says parents will provide food for C healthcare plan. So again, as long as it is referenced somewhere, I am not going to die on the sword of having it exactly where I want. I know where it should be. I know what it is supposed to be listed as, but I am not going to die on that sword. If it is referenced in the IEP, I'll explain why that's important. Then I am good with that. Some IEPs have a diagnosis healthcare concern section. So if your child also has diabetes, or your child also has ulcers, or your child also, can't have gluten. And then obviously this example has the other, some of the other health concerns that are related to PWS. So incontinence, weight gain, dehydration, intense hunger, daytime sleepiness, skin picking, and stunted growth. And then this district or this IEP actually referenced the codes. And then this one is another IEP that listed it as an accommodation. Again, I know it is a supplementary aid. I know that it is an associated plan, but if they want to list it as an accommodation, it is referenced. So this one explains, obviously, when the child's at school, there should be an adult within close proximity to ensure safety, making sure that they're not obtaining food that they shouldn't be, that making sure that the child only receives the snack and lunch items packed from home. This child's family does provide all snacks and meals, that they don't eat anything additional, that if anything has, then you contact the parent and you reference the healthcare plan. So why do we want the IHP on the IEP? In all reality, IHPs are not legally binding documents. Yes, it's a health document, and I sure hope that every school takes that document just as seriously, given the fact that any, if you veer off of that, can obviously not only be medically unsafe, but it can be deadly for students. So I would like to think that they hold it in the same regard, but it is not legally protected. So your IEP has legal protections, and as you probably have 1,000 copies now, if you have if your child's been in the public school for years, of your procedural safeguards that are part of the Individuals with Disabilities Education Act. So IDEA doesn't apply to a standalone IHP. So you have an IEP and you have an IHP, but your IEP doesn't reference the IHP, it is not protected. So they have no obligation to provide the free and appropriate public education, which we know needs to include these health precautions. The other thing is that if you don't agree, let's say the nurse goes rogue and includes stuff that's not appropriate for your child, or is refusing to include wording or protections about food security that you know are imperative for your child's health, without having it as part of the IEP, you have no way to fight it, honestly, because it is developed by the nurse. It's not part of the IEP team development. But if it is referenced in the IEP, again, you have all of the same precautions and procedural safeguards. And that also goes for a 504 plan if your child has a 504 plan. So where can you get information? These are just a few things that I kind of keep on hand. Obviously, your PWSA school success kit has a lot of information that is great to just hand over to your school's nurse, because in reality, your child is very likely the only child with PWS that that nurse may have ever encountered in his or her entire career. Same for teachers. Now, I will say there are a few districts right now I'm working in that has a handful of students, but that is absolutely rare. The IHP, that is the core form right there, that is, I found online, it's a fillable document that maybe if your school needs assistance or doesn't have their own, I have found that a lot of schools will actually turn to me, like, can you help us develop one? And I do maintain some kind of samples and examples, and things like this are really easy that a school could implement and, you know, put in with the child's cumulative record. And it's honest, it's really pretty. And then, of course, you have your National Association of School Nurses. They have the outline procedures in there, and then additional, which this healthcare plans for school nurses, I found to be able to download the entire PDF online for free. So again, if your school nurse or your school health aide is not as familiar with what really needs to go into an IHP, these are great resources for you and for the school. I have created a couple resource pages, and I am going to be sending these to Stacy so that when you get your link to this presentation, you'll have a copy of each of these. The one on the left I've had around, it is adapted from information from PWSA USA. Obviously, a lot of it is just that health information and strategies for the school to keep your child safe, but it does go into more than just hyperphagia. You know, obviously with food stealing and choking are also parts of it. So we want to make sure that there are staff that's trained in the Heimlich maneuver, or that they at least have a list of who is trained. Because if there's an emergency, you don't want the school just going around asking. They need to know who is trained, and that should also be part of the health plan. Again, the roles and responsibilities. Who is trained to give the Heimlich maneuver? That's the person that needs to be contacted if obviously your child begins to choke, or there's question if they have been able to completely swallow their food. And then the one on the right, I developed just for this training so that you guys have kind of a shortened and condensed information on IHPs for students with PWS in some specific areas of need. And again, I will have that available to go out in the email to everyone. And then that is the end. I know that's a lot of information, but again, you will get the resources and the training, and please feel free to reach out if you have any questions.
That was amazing. Thank you so much. Every time you speak, I learn something new. So I know there's questions in the Q&A, but I'm going to also ask some of my own as we go through.
Absolutely. So I'm going to take a little sip of my soda water because of my throat.
Yes, take your time. So one question was, will the PowerPoint be available?
Sure.
Okay.
I can send slides like as PDF, because honestly, guys, I make it in Canva, and if you don't have Canva, you can't always access it. So I can download it as a PDF. So yes.
That's awesome. And can you repeat what FERPA can disclose and to who? And then does it allow the nurse to discuss with the child's team since they're in the same school?
Oh, goodness. Yes, that's a really good question. So FERPA is to be able to disclose information to school personnel who require it to support your child. So that does not mean that the nurse is going to go talk to, well, I'm going to say this, and really you want the front desk person to know your child and their needs, but they're not just going to be able to go talk to anybody or, a teacher on another grade that has absolutely nothing to do with your child. That being said, we often recommend schools go through some sort of training as an entire school to have at least acknowledgement of what PWS is and why certain things might not be allowed in certain hallways, or, when teachers like to have snacks out in the hallway for kids that might be hungry, why they may not be able to do that anymore. And a teacher who's kind of set in their ways, because that's what we've always done, does often need to have that broader information. So even if it's not child specific, just giving an understanding of what PWS is and that there's a child on campus. So again, they can disclose information, medical information, to those who require it to service your child.
Who gets to
I think there was
determine
a
who
second part to
requires
that.
it?
What?
Who gets to determine who requires it?
Oh, that's a really good question. I would expect that would be something of, is this person in contact with your child? And I mean, they do define it a little bit better. I mean, but they do want to keep it loose, because you might want the front desk person to know, if your child's coming up there, you might want them to know. So it's typically anybody that's going to interact with your child is somebody that you want to know, and they're the ones that have access. Now, again, if your child is moving up in ages, somebody your child may have had in second grade is going to know, because they're now in fourth grade. But ultimately, anybody that's interacting with your child, but I often have parents who would rather more known than less.
Yes.
However, I do recognize there's also a lot, not every family discloses PWS right away. And that's obviously a personal and family decision. So if you disclose it to one person, you don't want the rest known, or why you need to have this. But again, to have that diagnosis and to have that full list of why. I mean, we can usually, I've gotten creative with some doctors of how we can word things. And there are obviously comorbid, it always sounds terrible saying that, but conditions that we can kind of list and explain why certain things are needed. But really, that disclosure of PWS explains better the idea of food security than almost anything I have found. I mean, we can go a lot of routes, but typically they want more than less.
Well, and I was thinking, as you mentioned, especially, here in Florida and school has started. Here in New York, it has not. But very often what happens, because our schools, probably the same in all schools, but they're very short-staffed right now. So who may be supervising recess could be somebody other than the classroom teacher. And when you think about that temperature regulation, that's something that you're going to want whoever could potentially be supervising recess
Absolutely
to have access to.
So again, usually broader, but I recognize if a family is choosing something different. But absolutely, with the recess, or yes, a lot of people are, kind of trying to manage multiple roles and responsibilities under maybe a title that they're, that's one part of their job these days. But yes, the temperature regulation, that kind of falls also into that subfolder.
Yeah.
Most, and I do get that written on some IEPs of the development of a subfolder, because if it's on the IEP, then obviously parent has consented to it, and we are now disclosing we're comfortable with that information being shared with the sub. Some teachers have go-to subs, and others it's a pick of the draw. You don't know who's going to be in there. If your child has a one-on-one, or your child requires an aide in a smaller ratio, then at least you have that, continuous support of somebody who does know your child. But if they're, things happen and the aide and the teacher are out, they got COVID, you don't want somebody coming in and having no idea as they bring in their snack and their lunch and their, whipped cream topped coffee, and it's all sitting in front of your child, and they have, likely some sort of behavior meltdown. Why is that happening? Well, you brought in some sort of dessert looking drink, and you're trying to teach my child today. So.
Great. On the resources page, there are pointers about PWS health concerns and where can you access that? Is that the health concerns handout that was in the school resources? The school system
I guess
did
it
that?
depends on what page they're referencing. So I put on the PWSA's education toolkit, if that's what that's obviously on your website at the last page where I had 2 resources that I developed. I will send those to you, Stacy, and they can, if you want to send that out with the link, then they can have those as well. So I'm going to make myself a note for slides and those handouts.
How early can an IHP be implemented? Can it be implemented when kids go to preschool?
Absolutely. If your child's in, well, yes, obviously depends on the age when you're saying preschool. So if you're talking they're under IDEA, so starting at age 3, then yes, because your child's likely has an IEP. If it's an IFSP, that's typically stuff being done in home or supporting therapy. So that they wouldn't necessarily need one then, but you would want your service providers to be aware of your child's needs. But to actually have that document in school would be when your child's school age. And for IDEA, that would be starting at age 3.
So I'm going to ask my own question now. And I'm asking because I've run into this situation. What happens when the nurse does not feel a health plan is needed? Can you appeal that decision?
I have not had that happen. But absolutely. I mean, I always would go up because they have their own supervisors. There are lead nurses in a school district. There are nursing directors. I've had some nurses that come in from the district to listen because they may not have a school-based nurse, and that nurse takes it and it's like, oh my gosh, I want to train the whole district. I'm like, fabulous. And then you have others that are like, typically, because it's so rare, they don't know about it. When you give them that information, they're like, oh, okay. You know, they do want to start again. I always think anybody in a school wants what's best for children, but people get set in their ways. How it was done is how we should always do it.
Well, and in this situation, I will say the district had had 2 other students with PWS prior.
So
they
they
felt like
often feel that they know.
they know, yes. And I did, I went above them and we had
Of
it
course.
done, but I just wanted to throw that out there.
That is definitely something that if a school, because it's so rare for a district or even a teacher or a nurse to have had a child previously, or actually right now at the same time in the same class, mind-blowing that again, they then want to generalize, right? And so that PWS is a spectrum. What may have been fine for this child to have in class, whether it was a toy that's a cookie or a book, is not going to always be appropriate, especially as they age or depending on the child. So that can sometimes be that tough part because they're like, oh, we can handle it. We know what to do. And we have to kind of go back that it's individualized for a reason, individualized education plan, individualized health plan for a reason.
Yes. Okay, so my son had an IHP at age 3 when he went to preschool through the county preschool program. That's great.
Yes, yes. The
And
earlier, the better. I find that, you know, as a child ages, sometimes that's also when schools get kind of like, well, we know them. We know what to do. We've been doing it for, 3 years. We've had, him or her on campus. We know what to do. So sometimes it's that early on, if you can get that in place, then it just continues. And then if a new SPED director comes in or a new special ed teacher comes in, it's already there. Taking it off, they're not going to be able to do easily. So if you can get it on early, that's fabulous.
Charles says to go to the next level for discussion and approval or put it in the IEP under accommodations. Yes, you've been listening, Charles. And then Donna said, you may want to ask a school district to have a special education nurse if possible, and then they would be responsible for writing the IHP. That's a great
So
suggestion.
there are students that do even require a one-to-one nursing aide for that reason, or if they need somebody who is trained in nursing. So obviously we have children that require one-on-ones for various reasons, at least in the school's mind, right? So they might have one that's for behavior and they might be, trained by the behavior team, or they might be contracted under more of an ABA. And then you have some that are, paraprofessionals where they can support education, but there are aides that are also nursing or health aides. And if your child does require that level, then yes, that is kind of the next, if that is what's needed, then that is what's needed.
Yes. All right. Are there any other questions? This really was incredible. Thank you so much.
Of course. I know when we were talking about plan, I was like, I want to get out there. I am so tired of schools not having, I'm like, how do they not have an IHP? You answer those 3 questions. Yes, yes, yes.
Yes,
I can't
yes.
imagine any parent on here not being able to say yes to those 3 questions. So obviously this is super important for all of us to maintain safety and security at school. You guys, families, send their children to school for the majority of their waking hours every day, 5 days a week. And you want to ensure that everybody that is going to be with your child understands their needs and what to do in case of an emergency. And that's what these plans outline and are, you know, they're proactive steps. We don't want there to be an emergency, but something might happen and we don't want everyone just sitting there going like, I don't know what to do.
Right. So we have a few minutes left. Would you like to share a little information about our upcoming project and what we need from all of
I
you?
absolutely made myself a note and totally like it fell off and I almost forgot. Yes, thank you. So as you guys may have seen through some social media posts, we are in the process of developing a parent advocacy training. So the idea of empowering families to be able to go into IEP meetings and feel that they know the information well enough to speak on it and to defend why they feel certain things are needed for your child, and not necessarily needing to bring in anybody because you're going to have that information. But to do that, I can think of 1,000 things that I would think a parent would want, but I don't want to develop it for me. So we developed a survey. Honestly, it says 5 to 10 minutes. I think it takes 3 minutes. I mean, everything is just click boxes of how much information, like how much do you feel you already know about certain things, because then I don't want to go over all of that and waste people's time. And then what are areas that are really important to you, or what are things that you want to have included? So there is a survey out there. I know it's been linked with PWSA. It's been linked with my website. And then we can obviously send it out when this goes out. We were hoping to have everything done by this Friday, Friday. I know that's super short notice, but we've had it going for a little while. I am open and I'm willing. We talked about maybe extending that a little bit. Just the quicker I get responses, the quicker we can start developing and implementing and having this course in series for parents. So I don't want to extend it too long because I really do want to get to the part where we can have the families participate in the series.
Yes, thank you. I'm very, very excited about what that's going to look like. Okay, what is Destiny's email again? Destiny, do you want to put that out in the chat for everybody?
Oh, absolutely.
And then when I send out the recording and the slides and the survey link, I'll also include the contact information as well.
I think
Awesome.
on the last slide, I had info at either one.
Yeah. All right. Well, thank you. And thank everyone for joining us tonight. So appreciate this.
I appreciate it. And thank you everyone for participating.